Hi everyone, my name is Nancy Tran, registered dental hygienist and Burst Senior Ambassador. Welcome back for another episode of Burst TV. Today's episode, we're going to talk about at what age do you graduate your pediatric patients from the dental office? Pediatric dental offices, that is. And the question is, we don't really talk about at what age you should really graduate your patients because people don't really think about it. I did an Instagram poll on social media asking my patients, also my friends who are also dental professionals, and majority of the responses were they didn't really think about it. As a dental hygienist, I've worked in pediatric offices, general family practices, as well as periodontal offices. So this is going to be my professional opinions from my experience and my professional suggestions based on how it would benefit as a patient, as a parent, and also as a dental professional. General rule of thumb is we start seeing pediatric patients from the age of 0, or when they first get their first tooth, to at least their last adult tooth erupting in their mouth, which is around the age of 12 to 13, their 12-year-old molars. Sometimes we still continue to see patients into their teenage years, but it really comes down to the patient in the dental office that caters to the patient's specific behavioral needs, their situational care, and then just patient preference. Sometimes when they are comfortable, if they're anxious and they have that relationship with the dental office and the team, they tend to pull it and drag it out as long as they can. Not every child needs to start off at a pediatric dental office. My kids, now 6 and almost 2, started off at my general family practice. We see a lot of kids, we see a lot of families there, and more than well equipped to take care of the kids and do pediatric dental procedures there. Sometimes we do refer to a pediatric dentist when the patient either has behavioral issues or situational needs, such as sedation, and we don't papoose in our office, so we send our patients out for general sedation or IV sedation to get the dental work that they need. And typically, if you do your research, a lot of pediatric dental offices will say at least until the age of 12 to 13, when you have your last adult tooth erupt in the mouth, that would be the time for you to graduate and go to a adult dentist so that you can get better focused care as a young adult, because you're going to start developing younger adult habits. As you go into your adolescent years, your teenage years, you're going to start slacking on your brushing habits. You might have more buildup that starts to accumulate that a pediatric dental office may not just be able to do within the time that you have. So that way you can start learning more one-on-one home care instructions on how to brush. You have better recommendations on products and techniques that can better help your developing teeth as a young adult. So really there's no right or wrong answer. A lot of times as dental professionals, we like to assess the patient and the provider relationship and how it works out. I understand sometimes your first dental milestone happened with your first dental team, and keeping that in-house and keeping that relationship is very, very crucial and important. If you have a good experience, you want to keep the experience is good, or else sometimes dental anxiety can peak when you experience new relationships, new dental offices, new teams. I would say that if you are old enough to sign your own papers as a legal guardian in a pediatric dental office, it's probably time for you to graduate and start seeing a general office where they can better cater to your needs as an adult and be able to further assess different procedures that may be required. So it's just a really fun thing to talk about, because I love when I take my children to pediatric dental offices or their pediatrician, because the atmosphere, the environment is so much more pleasant. It's more fun. It's like a kid walking into a candy store. You have all the fun colors, the walls are painted, you have a play area. It's just a fun, loving experience. However, sometimes when you have that fun, loving experience, the reality of it is it's just all fun. You know, when do you really sit down and you actually show the kids how to properly brush their teeth, how to tackle and address different concerns that we're having? Because to me, what I've experienced when I go to pediatric dental offices, it's more about the parent and the provider relationship versus the kid and the provider relationship. And just within this year alone, I've taken my daughter Aria to 3 different pediatric dentists because we had referrals for different things, different needs. So Sometimes it's very limited as far as what procedures can be done in the office, where you just rely on several teams of dental professionals in different offices to tackle one big treatment plan. Versus if you are in a adult dental office, then majority of the general practices have that the resources to do everything in one office, especially nowadays with dentists being a lot more trained and having additional CE. That just really makes it so much easier in developing long-term habits as an adult, because we don't want you to be stuck in your younger years, if that makes sense, because once you're used to doing things a certain way, you tend to not explore different options that may be out there and work better for you. Those are just a small tidbit. It was a good topic that came up, and I just figured I kind of talk about it and kind of share my experiences of what I think or what age you should or shouldn't. There's no right or wrong answer, again, like I said. But, you know, if you think about that little movie, the Christmas movie, where Will Ferrell played the elf or Buddy, and he still had the mindset of a pediatric patient, but everything was fun-sized. He sat in the chair and it was too small for him, and just, you know, it wasn't where he needed to be. You can see that he was clearly out of place. So we want to make sure that if you're going to an office and you're still at the pediatric office, though you have a good relationship, it's important to make sure that you make others feel comfortable around you as well. So that's just some things to think about. And again, like I mentioned earlier, not every child or not all children need to go to a pediatric dentist. It's based on their comfort level. So if they are comfortable going to a general practice or an office where the rest of the family goes, then by all means, it's good. And I think it's great for their maturity level and their growth. However, sometimes you just have to know when to cut ties with your pediatric dentist, or they will cut ties with you. I have worked in an office before where their oldest was a college student, actually graduated high school, went off to college for the first semester, and then they decided, like, okay, it's probably time for us to call it quits and maintain our relationship outside of the dental office, because they became family friends. Other than that, I hope that this quick video just kind of helped plant some little seeds and just some things to think about, and just to know what questions to ask and what options you have. If you haven't already subscribed below, please do, so that you can come back and enjoy some future tidbits on Burst TV. Thank you so much. Have a great day. Bye.